Welcome to the ASCO Guidelines episode of the ASCO University Weekly Podcast. My name is Dr. Betty Ferrell, and I'm a professor at the City of Hope National Medical Center. Today we feature an ASCO guideline, the Clinical Practice Guidelines for Palliative Care. I'm very pleased to have the opportunity to share some information about this guidelines on behalf of the committee. The purpose of this version of the ASCO guideline was to update the previous provisional clinical opinion on integrating palliative care into standard oncology care. We're fortunate that there is a great deal of new information to guide us in practice. Patients with advanced cancer are defined as those with distant metastasis, late-stage disease, and those with a poor prognosis are in particular need of palliative care. This update emphasizes that all patients can benefit from early integration of palliative care. The ASCO Clinical Practice Guidelines Committee process included a systematic literature review, an expert panel providing critical review of the evidence, final guideline approval, and the full methodology can be found on the ASCO website. These guidelines addressed several clinical questions. The first was, what is the most effective way to care for patients with advanced cancers and their symptoms? The recommendations provide direction for interdisciplinary palliative care teams to provide both inpatient and outpatient care early in the course of disease. The second clinical question was, what are the most practical models of palliative care, and who should deliver this palliative care? The recommendation includes several important thoughts about how palliative care for patients with advanced cancer should be delivered through the specialty team, but it's very important that this care is provided in both inpatient and outpatient settings. The third clinical question is, how is palliative care in oncology defined or conceptualized? The important characteristics that are identified in this recommendation is that palliative care should exist to establish rapport and relationship with patients and families as they make difficult decisions, to provide symptom and distress management, to explore understanding and education about the illness, clarify treatment goals, assess and support coping, and to assist with medical decision making. The fourth clinical question was, how can palliative care services relate in practice to other existing supportive care services? The recommendations include discussions about how important it is that palliative care works closely with other services such as navigators, pain management services, and other consultation in order to best deliver supportive care. The fifth clinical question is, which interventions are helpful for family caregivers? We're really impressed with the growing evidence about family caregivers, since they are in fact the people who provide the vast majority of care to patients. So the recommendations in the guideline suggest ways that we can be most supportive of our family caregivers. The sixth clinical question is, which patient should be offered or referred to palliative care services, and when in the disease trajectory? And are there triggers that could be employed? There is special commentary in the guidelines suggesting that all patients should be considered for palliative care if there are symptoms and quality of life concerns that might benefit from specialty palliative care. But also a very important point is that it is important for all clinicians to increase their knowledge and skills in palliative care so that we have both generalist as well as specialist palliative care delivery. A key message of these guidelines is that there is growing evidence that suggests that palliative care should be well integrated in all aspects of oncology care. We invite you to review the guidelines in more detail and encourage your input to ASCO as we continue to advance palliative care as a key component of quality cancer care. Thank you for listening to this week's episode of the ASCO University Weekly Podcast. For more information, be sure to check out ASCO University's quarterly e-learning series on ASCO guidelines, coming in 2017, by visiting university.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.